Across this country, child health systems and their community partners are joining together to address adverse childhood experiences, or ACEs, in the context of adverse community environments. The Building Community Resilience Collaborative is aimed at addressing this American public health crisis by joining healthcare, public health, community systems, and parents in a multifaceted approach to build more resilient communities. 22% of all American children have at least 2 or more ACEs. These include physical, emotional, or sexual abuse. Some have witnessed violence, either in their own home or community. And this is in line with data indicating nearly 10 million children live in violent neighborhoods. Compounding the effects of community violence, nearly 45% of our nation's children live 200% below the federal poverty line. These statistics indicate that households that should be focused on providing nurturing environments for children are instead grappling with the crippling effects of poverty, often living in poor housing conditions, struggling to put food on the table, while balancing fears for their emotional and physical safety in a neighborhood that is besieged with violence and crime. In order to build resilience, sectors must come together to provide buffers for many of these stressors that are daily occurrences for far too many children, families, and their communities.
So I think for a community to really be able to be resilient, they have to have a common understanding, share a knowledge base, share a language, share values, and then share how they're going to be together, what they're going to actually do that makes sense.
The Building Community Resilience approach provides healthcare partners a framework to develop a shared understanding of the adversities associated with poverty that have an impact on health and well-being. Through a strategic assessment process, they're able to assess their own capacity to respond to upstream social determinants, build a coalition of cross-sector partners, and engage parents, families, and community stakeholders in the resilience movement.
We focus on quality education programs, food, nutrition, and family supports. And we really think that through providing those things, we can help to build stronger children, stronger families, and stronger communities. And we don't want to do it in a bubble. And so it's really important to continue to partner with organizations who are doing similar work.
This upstream approach comes at a pivotal time in our nation's thinking about how to deliver healthcare, public health, and other community-based services. BCR provides a model that fosters collaboration across sectors to address both health and social determinant needs, some of which are associated with poverty, some of which are ingrained in our systems, such as institutional racism, inequities in community investment, and inequitable distribution of resources that negatively impact health and well-being.
There are a lot of structural barriers that exist from the standpoint of how communities are built, the physical resources and the economic resources that are so limited in many communities. There's also the way that public services are organized and things are siloed into health-focused or education-focused or mental health-focused or housing-focused. And we're sort of convinced, as are many others, that those things are intimately interrelated, and yet strategies to change any one of them sort of has to stay in its lane, according to the old way of doing things.
Change is slow, and everyone's working harder for less, and everyone's busier than ever. So this work, in order to succeed, has to be integrated into current workflows. Workflows need to be modified and changed so that we're able to incorporate our knowledge of adversity and the effects of adversity into the care we deliver.
Through the generous support of the Kresge and the Doris Duke Charitable Foundations, we have brought together 5 of the country's leading health systems to build a bridge to the community, a pathway by which community organizations and cross-sector partners can help address adverse childhood experiences in the context of family and community. We're developing a shared understanding and sharing our learning across teams.
The BCR Collaborative is about going deeper versus just wider.
As part of the Building Community Resilience movement, we are building bridges to community a journey that requires building coalitions based on trust.
Without trust, nothing good happens between human beings. So we have a lot of trust rebuilding to do. There are things that have happened that are really, really traumatic and bad and make people's lives so terrible. So the rate of poverty that we have, the long-standing history of racism that we're dealing with across the country, right? That trust has been so eroded in just an understanding of who you are in reference to who I am. What can I expect out of my social group? What can I expect from other people? So what I think the way it's talked about is the erosion of social capital.
By connecting systems to grassroots efforts underway in communities, as well as fostering the growth of those community-initiated efforts that will improve health and well-being, health systems can truly be partners in not just the delivery of healthcare, but the fostering of a culture of health.
What really needs to happen is like a revolution. It really is like a political and economic revolution in the way that we structure, health and social services in our country.
Building community resilience is about providing a framework for this revolution in healthcare and public health by connecting systems and communities at the grassroots level.
And I think that that's what's happening in our community is that we're convening and building an arena for people to talk about kind of this universality of trauma rather than there's something wrong with you as an individual. In some ways, we've all experienced traumas to one degree or another.
This co-collaboration and co-creation of solutions, and it really helps us think about what families do well. So as Angela Blanchard would say, you don't build on broken, you build on what people already do.
The path forward, although uncharted, provides promise. And with BCR, we are creating a roadmap for others to follow. We recognize that resilience will come from healing. Healing comes with trust, a trust that is built over time.
And this is the toughest thing for us to do because, trust, at the end of the day, we're trying to develop trust
and relationships
that we have not been really good at doing. And so to be able to put ourselves in that vulnerable place, to know that we don't know who we're really talking to, but we have to keep trying. Mm-hmm. We can't stop. That's going to be, I think that's one of the biggest challenges for us in working with community.
So enter with humility.
Humility, What do we say in our BCR meeting? Take off the white coat and be a citizen.
We want to share our lessons learned, our tools, and our resources. Currently in development is a communications platform to help coalitions and systems tell the story of ACEs to key stakeholders. We're also developing measures and data reporting to measure the impact of cross-sector collaborations in public health. Come join our community as we help to build community resilience across the nation.